Hello, everyone. Conference Chairman, ladies and gentlemen. First, thank you for the organizing committee invitation. It's an honor to share the latest research on Crisugabalin at this International Forum on Neuropathic Pain. Today, I want to talk about the treatment of diabetes peripheral neuropathic pain. The topic is rapid onset of pain relief with Crisugabalin in patients with diabetes peripheral neuropathic pain. Findings from a multicenter randomized double-blind control study. In the next 15 minutes, I will present the trial and the findings. So let's start. First, the key message of the trial. As a novel drug, Crisugabalin is researched and developed by Haskell Pharmaceutical Group, and Crisugabalin is a novel potent selective ligand of the alpha delta subunit of voltage-gated calcium channels for the treatment of diabetes peripheral neuropathic pain, DPNP. Crisugabalin rapidly improved analgesic result. Titration was efficacious in relieving pain of Chinese patients with DPNP. The background of the DPNP, as we know, chronic diabetes peripheral neuropathic pain affects 16% of patients with diabetes. Patients undiagnosed, 12.7%, and untreated is 39%. The moderate to severe unremitting pain is present in over 70% of patients with DPNP, resulting in insomnia, poor quality of life, mood disorders, and 5 times increased healthcare costs compared with diabetes alone. As for treatment, commonly prescribed drug for the management of neuropathic pain, such as pregabalin, gabapentin, amitriptyline, or diloxandin as first-line agents for symptomatic analgesic therapy in patients with DPNP, but they are necessary to titrate slowly for a period of time. This may result in a delay in the onset of pain relief. The recommended medications are inadequate to relieve the pain, which is often accompanied by dose-limiting side effects. A full dose or reaching a full dose through dose titration is an important basis for significant pain relief. Dose titration affects the treatment satisfaction of DPNP. As the data analysis results of Crisugabalin is rapidly relieving DPNP as published in Pain and Therapy. And the primary research is a multicenter randomized double-blind placebo and pregabalin controlled parallel group study. It has been published in JAMA Network Open, and the design of this study is dependent to that of the primary research. The main purpose of this further statistical analysis is to evaluate the efficacy and safety of Crisugabalin in patients with DPNP, specifically focusing on its rapid onset characteristics. We choose the 4 blue groups to conduct further analysis. The analysis include a population sample of 596 cases, divided into 4 groups: Crisugabalin 40 mg per day, and Crisugabalin 80 mg per day, placebo, and Pregabalin 300 mg per day. That is titrated from 150 mg per day for 1 week, according to the package insert. The mean age was 58.6 years. Mean weightage was 66.93 kilogram, and the body mass index was 24.6 kilogram per meter square. The primary endpoint is the primary efficacy endpoint. Crisugabalin has a Crisugabalin has the results shows that from week 1, the ADPS in the Crisugabalin treatment groups showed significant improvement compared with the placebo groups, and this effect persisted until week 13. In contrast, the Pregabalin group showed a relatively delayed effects, with significant differences from the placebo group only observed at week 6. In confirming that Crisugabalin has a sustained analgesic effect throughout the entire treatment period. When evaluation the NRS score, when evaluating NRS score of subjects on a delay basis, it was found that compared with the placebo, unlike Pregabalin, with require 1 week titration, Crisugabalin achieves significant pain relief by day 2. Similarly, on the second day, the daily sleep interference score also showed significant improvement. It can be seen that Crisugabalin has the characteristics of rapid onset. And I would like to talk about safety and tolerance of Crisugabalin. The table showed that the treatment emergent adverse events of greater than equal to 1% by Peripheral terms. As you can see, most treatment emergent adverse effect was mild or moderate and can self-recover without requiring treatment. Compared with placebo, dizziness, drowsiness, weight gain occurred more frequently in the Crisugabalin treatment groups. The result showed that safety and tolerability of Crisugabalin was well acceptable. Of course, our result has some limitations. First, Crisugabalin can improve analgesia without titration, which can simplify the treatment process of DPNP and make the clinician convenience. And there is no increased risk of security as well. But Pregabalin and doloxentine can't do it. The second, from this study, compared with placebo, Crisugabalin showed rapid onset of pain relief and sleep improvement on the second day, while Pregabalin group showed a relatively delayed effects. In this trial, we can draw the following conclusions. First line recommended drugs in previous guidelines. A full dose titration is crucial for pain improvement. Crisugabalin does not require titration and can be directly administered at the recommended effective dose. It can rapidly relieve pain and improve sleep on the second day. The Crisugabalin demonstrated good overall safety in phase 3 trials, with most adverse reactions being mild and controllable. Thank you for your attention.